The Center for Disease Control and Prevention is reporting a higher number of flu cases than normal, and people are being urged to get a flu shot.
We are, in fact, at the height of flu season already. Australia's had a particularly bad flu season this year for a number of reasons.
For more on this, we are joined live in studio by KTVU Medical Expert Dr. Larry Burchett. Kind of what Gasia just said there, Australia. Should we rely on what happened in Australia? I mean, does that mean anything?
Does it travel this way, in other words?
Yeah, no, that does happen. And I think the thing we learned from Australia is which flu, is it flu A or it's flu A, H3N2. And what that means is that type sometimes doesn't respond very well. It's hard to vaccinate.
Right.
Okay.
It's like, oh, so maybe the vaccine's not going to be so good. They had a rough year. Maybe, it's not 100%, but
Right.
maybe it'll be bad.
Mike has been prodding me to get my flu shot, and I did for a few reasons.
Prodding you? I mean, I haven't even gotten
Good for you.
So here's why I did. First of all, my husband shamed me into doing it, and I wanted to be a good model for my children. And it was free at the pharmacy. But now that I'm seeing
all good reasons.
All good reasons, and now that I'm seeing that it was, I think, 10% effective in Australia, I'm thinking, did I just waste my time? Did I do myself any good, even if the vaccine and the flu don't match up this year?
It's a great question. Most people are going to look at that kind of from the individual perspective. Is this going to 100% prevent the flu for me? No, it won't this year. But it will translate over everybody to saving lives. If everybody got vaccinated, it would absolutely have an effect. And the other thing is, it's the best thing we got. Like, there's not much else we can do. So now we're like anticipating maybe this one will be worse. I would still make an argument for the flu shot.
Isn't the best thing we have washing our hands?
That's really good too. Avoiding getting sick. So the flu is respiratory droplets.
So you go out and, let's say you go out and you shake hands during the day, you should be washing those hands all the time, right?
All the time, but yeah, washing your hands can prevent viral spread illness, absolutely.
What about peak season? I feel like sometimes it varies, right? So I think last year, maybe in the year before that, it was more springtime, more like March. I think 3, 4, 5 years ago, I'm talking about across the United States, not just here in California, it was December.
Yeah.
Do we have a read on when peak season is? Because you may be in January going, oh, I beat the flu this year, but hold on. Like,
no, you're exactly right. That January would be too early to call it. End of February. We watch kind of the spike in flu, and we haven't had that yet.
Right.
This is the beginning. This is kind of the trickle, 2% of people coming into the office are for the flu. That's not very much.
So it's not too late to get the flu shot.
It's not too late to get the flu shot, but I would anticipate it's really going to hit more end of December, January, February. Once you get to March, then we're usually through it.
So if I don't get the flu shot, I mean, Sal, you mentioned washing your hands, but what about other, I try to drink as much fluid as possible. You watch your diet. What else plays a role in regards to preventing the flu? And just in case I or someone else out there doesn't want to get the flu shot.
So some of those things you're talking about in terms of kind of keeping your immune system up, sleep, managing stress, how hard are you running?
All play a role.
It's the shot for you, Mike. No.
Well, I guess I would turn and ask you, like, what are you doing when your body gets run down, like day to day?
Yeah.
Right?
What causes that? Like too much work? So these kind of things factor in also. So
drinking.
Alcohol, absolutely.
Holiday season.
Yeah.
Last year this time, it was cold, it was rainy, it felt like flu season. It's almost 70 degrees in the afternoons here in Oakland. I have a hard time squaring that we're entering the height of flu season with it's so gorgeous and sunny out.
Yeah. You may have to reconcile those when the flu comes in a couple weeks or a month.
Okay. Do you think people might be sort of lulled into this sense of it's not going to be a bad flu season because it's not flu weather? I know there's no such thing, but
no, you're exactly right. It's probably out of your mind. If we didn't have these numbers from the CDC and be talking about it, people might not think about it.
Do you ever get the flu?
It's been beautiful.
Do you get the flu?
Oh, good.
Or is it not good?
The one day of work I missed in 11 years is when I had swine flu, H1N1. It was awful. It was awful.
Wow. You missed one day.
One day.
It was in and out.
Boy, you're a machine.
I had a fever. I was like, I can't really go in. Like,
pass that on to
you
all
don't really
you.
have backup in the ER. You're there.
Okay, get the flu shot.
Thanks,
Here again,
All right,
Dr.
thanks,
Burchett,
guys.
thank you.